Hi everyone, my name is Dr. Emily Delpero, and I'm an obstetrician gynecologist practicing now in the Toronto area and soon to practice in Ottawa. Today we're going to talk about vulvar itch. First of all, what is the vulva? The vulva starts with the mons pubis in the front, the skin of the perineum at the back, and this also includes the clitoris, the labia minora, which is the inside lips, and the labia majora, which are the outside lips. And every person, you should know, is different in shape and size. When people get an itchy vulva, many people think about yeast infections or about bacterial vaginosis, which isn't exactly an infection, it's just a shift in the type of bacteria that are growing inside the vagina and can lead to itch on the vulva. But what are other causes to think about? Number one, your skin is sensitive to something that is coming into contact with it. Like what? So very common contact irritants include soaps, wipes, detergent, synthetic underwear, latex, sexual lubricants, urine, menstrual or incontinence pads, or even too much water. Number two, just like you can have skin conditions elsewhere on your body, like psoriasis, you can also have these on the skin of your vulva. A common autoimmune condition for the vulva is called lichen sclerosis, which can be accompanied by white skin changes, very itchy skin, and scarring changes to the vulvar anatomy. A third thing can be that sometimes the skin can get itchy because it's been scratched. The skin adapts to being rubbed and scratched and tends to get thicker and more leathery and more itchy. This is called lichen simplex chronicus, or an itch-scratch cycle. The fourth thing is that sometimes an itchy growth on the skin can be a wart, a precancer, or rarely even a cancer. These conditions can be diagnosed and treated by a specialist and may need a small biopsy to confirm the diagnosis. Sometimes there's more than one thing going on. For example, sometimes it was a yeast infection that leads you to rub and scratch the skin, and maybe you choose a different, stronger soap at the pharmacy, which irritates your skin further and makes it more itchy. And then you are stuck in an itch-scratch cycle that you can't break. So what can you do about it? Here's some Vulvar Hygiene 101 that can apply to anybody with a vulva. Number one, no special cleaning products. Speed walk past that aisle in the pharmacy and put down the Vagisil. Next thing you can do is just wear cotton underwear if possible, loose-fitting clothing, or no underwear even so at night. Generally, we advise also no soaps directly on the vulvar skin, just water if possible. Some people don't really feel okay with this, and in that case, we would advise using something like a gentle face cleanser that tends to be non-drying. Another thing you can do is consider using a silicone menstrual cup or tampons or cotton-based menstrual pads, but try to avoid things that are really scented or have lots of preservatives in them that may also irritate the skin. Some people also find relief by adding something like Vaseline or coconut oil on the skin if they're finding that they're dry. And it's very hard to do harm with something like Vaseline or coconut oil on the skin down below. Finally, a very important thing is trying your best not to rub or scratch. You can use cold compresses instead, and sometimes even people wear mittens or gloves at night to reduce the impact of the nails as they scratch on the skin. The less traumatized the skin, the better. Finally, see your doctor for an exam. Many of these conditions are diagnosed and treated with the help of a specialist. Treatments depend on the diagnosis and can range from topical ointments to oral medication and sometimes even surgery. The bottom line is, don't go it alone. Thanks everyone for tuning in and watching this video about vulvar itch. Check out more information on women's health education made simple social media platforms like Twitter and Instagram. Bye for now.